Good afternoon, Chairman Hernandez, Senator DeSaulnier, Senator Monning. Thank you so much. My name is Bill Feyling. I'm with the Northern California Carpenters, and I'm the chairman of the Carpenters Health and Welfare Fund for Northern California on the labor side. So we're a relatively small fund. We have about 60,000 covered lives. And of those 60,000, about 55% of them are Kaiser. So Kaiser is one of our biggest cost drivers. We don't send them a lot of money. We send them about $15 million a month. And in the Kaiser world, that is sand, a pebble of sand on the beach. But our premiums are scheduled to increase 51.5% over a 6-year period. And it's just clearly not a sustainable model. It's curious. In full disclosure, I am a Kaiser participant, and I like the system. But it seems like it should be so much more efficient. They own the docks, they own the hospitals, they've done the big integrated IT project. They say they're doing everything right. I hear the commercials that say they're thriving. Unfortunately, our fund is not thriving. Our fund is extremely challenged to try to meet these economic demands. And when we do go to speak with Kaiser, despite our pleading with them for more transparency and more explanation of how these rates are derived, it's a black box. We're not of the size that they feel they need to disclose, and so consequently, there's no ability for us as the consumer to try and affect that trend. And when it seems like a one-way street. When you go to add a benefit, it's expensive, but when you go to take a benefit, cut a benefit out of your plan, it's worth pennies. So clearly, I'm not smart enough to be a senator. But if there were some sort of, or maybe it could be the other way, I'm not sure, because you guys are crazy to do what you do sometimes. But I know I do help, yes, and we are proud to help. But basically what's going on right now is this medical industrial complex has an insatiable appetite for greed, and something has to be placed on transparency so we can have a say in figuring out how these rates are developed and what we can do to try to affect these rates. And it's not coming from Washington, D.C., obviously. California needs to be bold, and we need to act. And I really appreciate the opportunity for you to have and to speak today, and that you convened this. It really means a lot to us. So thank you so much.
Thank you very much. Any other closing comments from any of the members? Seeing none, I just want to take the opportunity again to thank all the presenters.